Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that is used to relieve pain, fever, and inflammation. This includes painful menstrual periods, migraines, and rheumatoid arthritis. In this video, let's found. What is ibuprofen? What is ibuprofen used for? Contraindication. What are the side effects of taking ibuprofen? How does ibuprofen work? How to use ibuprofen. What is ibuprofen? Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID. It works by reducing hormones that cause inflammation and pain in the body. Let's look back at the development of the history of ibuprofen. The formula of ibuprofen is 2-for-isobutylphenyl, propionic acid, and its initial development was in 1960 while researching for a safer alternative for aspirin. 8 Ibuprofen was finally patented in 1961, and this drug was first launched against rheumatoid arthritis in the UK in 1969 and USA in 1974. It was the first available over-the-counter NSAID. On the available products, ibuprofen is administered as a racemic mixture. What is ibuprofen used for? Ibuprofen is the most commonly used and prescribed NSAID. It is a very common over-the-counter medication widely used as an analgesic, anti-inflammatory, and antipyretic. The use of ibuprofen and its enantiomer dexabuprofen in a racemic mix is common for the management of mild to moderate pain related to dysmenorrhea, headache, migraine, postoperative dental pain, spondylitis, osteoarthritis, rheumatoid arthritis, and soft tissue disorder. As ibuprofen is a widely used medication, the main therapeutic indications are patent ductus arteriosus, rheumatoid and osteoarthritis, cystic fibrosis, orthostatic hypotension, dental pain. Investigational uses efforts have been put into developing ibuprofen for the prophylaxis of Alzheimer's disease, Parkinson's disease, and breast cancer. Contraindication. You shouldn't take ibuprofen if you have a history of a strong, unpleasant reaction, hypersensitivity, to aspirin or other NSAIDs. Have a current or recent stomach ulcer, or you have had one in the past. Have severe heart failure. Have severe liver disease. Are taking low-dose aspirin for the prevention of cardiovascular disease. You should use ibuprofen with caution if you're aged 65 or over, breastfeeding, or have asthma, kidney or liver problems, lupus, Crohn's disease or ulcerative colitis. Previously had any bleeding in your stomach, high blood pressure, hypertension, narrowing of the arteries, peripheral arterial disease, any problems with your heart, such as angina, heart attacks, or mild or moderate heart failure, had a stroke. Side effects. Some common side effects of ibuprofen are headache, dizziness, drowsiness, diarrhea, constipation, gas, sores in the mouth, sweating. For strains and sprains, some doctors recommend waiting 48 hours before taking ibuprofen because it may slow down healing. If you're unsure, speak to a doctor. Pharmacodynamic. Ibuprofen has multiple actions in different inflammatory pathways involved in acute and chronic inflammation. The main effects reported in ibuprofen are related to the control of pain, fever, and acute inflammation by the inhibition of the synthesis of prostanoids by COX-1 and COX-2. Pain relief is attributed to peripheral affected regions and central nervous system effects in the pain transmission mediated by the dorsal horn and higher spinothalamic tract. Some reports have tried to link the pain regulation with a possible enhancement on the synthesis of endogenous cannabinoids and action on the NMDA receptors. The effect on pain has been shown to be related to the cortically evoked potentials. Mechanism of action. The exact mechanism of action of ibuprofen is unknown. However, ibuprofen is considered an NSAID and thus it is a non-selective inhibitor of cyclooxygenase, which is an enzyme involved in prostaglandin, mediators of pain and fever, and thromboxane, stimulators of blood clotting, synthesis via the arachidonic acid pathway. Ibuprofen is a non-selective COX inhibitor and hence, it inhibits the activity of both COX-1 and COX-2. The inhibition of COX-2 activity decreases the synthesis of prostaglandins involved in mediating inflammation, pain, fever, and swelling, while the inhibition of COX-1 is thought to cause some of the side effects of ibuprofen, including GI ulceration. Half-life. The serum half-life of ibuprofen is 1.2 to 2 hours. In patients with a compromised liver function, the half-life can be prolonged to 3.1 to 3.4 hours. Dose. Use. For the relief of signs and symptoms of rheumatoid arthritis and osteoarthritis. For the relief of signs and symptoms of primary dysmenorrhea. For the relief of signs and symptoms of rheumatoid arthritis and osteoarthritis. Oral, for the relief of mild to moderate pain. 4. For the management of mild to moderate pain, and the management of moderate to severe pain as an adjunct to opioid analgesics. Dose is 200 to 400 mg orally every 4 hours as needed. Maximum dose, 3,200 mg per day, prescription strength, 1,200 mg per day, over the counter. Comment. Treatment should begin at the earliest onset of pain. Safety advice. Ideally, pregnant women shouldn't take ibuprofen unless a doctor recommends it. But ibuprofen appears in breast milk in small amounts, so it's unlikely to cause any harm to your baby while you're breastfeeding. It's best to tell your GP, pharmacist, or health visitor about any medicines you're taking. Paracetamol is recommended as an alternative to ease short-term pain or reduce a high temperature. That's all the information about ibuprofen we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.